Welcome to the Michael Zehr Show on a Wednesday evening, coming to you on May 17th, 2023, from the Warrior Healing Center in the Rising Eagle Studios. I'm not going to be doing my Friday show because I will be at a convention, and Kathy said, would I come in and talk to these two gentlemen here that are sitting with me? And I said, sure, I would love to. So here we sit. So let me introduce to you, to my far left here is Dr. Nick Rainey, and then this is Dr. Mike Davis, and they are with the Rainey Pain and Performance Clinic. Did I get it right?
You nailed it.
Hey, I got something right. I'm happy. So the first thing I would like to ask is, how did you two meet?
Go for it.
Okay. We feel very blessed. I had the clinic started in November 2016. I think 2016. And it was getting pretty busy, and I thought I would really like to grow as somebody who wants to be great. And so I put out something on, it was through Evidence in Motion, and they have a residency program. I said, I'd love to have a resident, because I was residency trained, if somebody wants to come in and learn. And I put it on there within 2 weeks. Dr. Davis had emailed me looking to see if this might be a good fit. We've had nobody reach out on that platform since then about it.
Wow.
And it's been on there ever since. So it feel like it was just very, very awesome that he saw it, reached out, and it's been I've really enjoyed working with him.
So kismet, in a way, kind of meant to be.
Yeah.
Type thing. So your company is called Rainey Pain and Performance. Can you tell us what that means, about the name and what it is you do?
Well, when I started, I didn't know that we would. I thought it would be just me, so I put my name in it. If I would have known how it would be, I probably wouldn't have done that. Now there's about 10 or so of us providers.
Really?
Yep.
Wow. So you're pretty big then. I thought it was just the two of you guys.
Yeah, we're the largest in Cochise County.
Wow.
So. And then I didn't want to put physical therapy in the name. I didn't want to put therapy. Some people have negative connotations. It depends on what experience they've had before. So I wanted to be known for more than just what their preconceptions were of physical therapy. So we put, what do? We decrease pain, we increase performance. No matter where you're at on there, that's what our main goal is. We want people to know that we specifically treat pain. We're not just there to exercise them.
Are you considered a pain clinic or pain management then?
Kind of. We like to use the term functional pain management.
Functional pain management?
Mostly because the connotation with pain management is physicians or nurse practitioners with medications, spinal cord stimulators, injections, RFAs, more invasive intervention, since that's not us. So we put pain in there, so that way it makes people curious about what we do. Okay. And all of ours is conservative. There's no medications with it. We're not totally against those. Some people need those, but that's not what we do in ours.
What is it that you do? Can you give us a little bit more of an idea then on what your treatment would be for, let's say, someone like myself. I have ankylosing spondylitis. I were to come in and I were to see you and I were to have a lot of like back pain or hip pain. How would you go about treating something like that?
That's a great question. I'll let Dr. Davis talk since I've been talking mostly so far.
Yeah, so something like that, we generally would have you come in for an evaluation and we try to get an idea of the story. The story tends to get lost. And I think if we could just listen for a while, we tend to understand a bit more where the person's coming from, how it's been progressing. Once we get an idea of that, then it's a little easier to look at objectively what's going on.
Because one of the biggest things being a veteran and going to the VA hospital, they had this big push where they started cutting everybody's pain meds, and they didn't give us any warning or anything. They did it. And they said that pain clinics now have to authorize pain medication and stuff like that. And it became very stressful. It was not a pleasant thing to have to be dealing with the VA on that subject. So that's why I was asking you both on.
Yeah, so it brings up a great point where we like to focus is on what else can you do besides pain meds? It's frustrating to have those cut if that's the only thing that you found that can help manage your pain, right? I mean, I get that that's a very challenging situation. And so we're looking at all the other things that we can do to manage it. Where is it? Manual therapy? Are there any manipulative techniques? Is there any needling? We do a lot of needling without medication.
Oh, wow.
Is there certain times of day when it affects you more than others? And so then we're looking at that. Is there a right amount of exercise? Exercise, we all know it makes us healthier. Healthier bodies typically feel better. But if exercise fixed everything, then you're not going to be, we don't need a job. Everybody's going to figure that out. Hey, every time I exercise, I feel better. The next day I exercise, I feel better. The next day I exercise, I feel better. And so it's about managing it, about, okay, this is how much you should push. This is when you back off. This is how you gauge it on your own. And so it's all the other stuff.
What was it that draw both of you into becoming in physical health? What drew you to that?
Starter.
For me, it was my parents both needed quite a lot of help. I saw them basically grow up with physical therapists and occupational therapists. So seeing that did improve their quality of life, that drew me in for sure. So at a young age, I think I wanted to do that.
For me, I was in high school and I had to do a career day somewhere. And so I shouted a personal trainer in town. This is when we lived in Utah at the time. And I decided I wanted to be a personal trainer basically for athletes, work at a university. I talked to a strength and conditioning coach at the university I was at BYU, and he told me his career path. I said, that's what I want to do. And he said, actually, this is the better path, going to physical therapy school. And so I changed. I really didn't know much about the profession. I thought I still wanted to work with athletes, which I do enjoy working with athletes. But I've really found a niche with treating people who are in pain. A lot of people like working with athletes. A lot of people don't like working with people in pain because they don't know how to answer their question. They don't know what is the best way for them.
So we have a comment here from Brian Tackett. Said, that's my physical therapist. So.
Thank you, Brian.
Dr. Davis, I understand that you're a military veteran. Can you tell us a little bit about your service, what branch you were in, what your MOS was?
Yeah, so I was 11 Alpha. I was an infantry officer in the Army.
Okay.
And started out actually as a combat engineer for a couple of years until I realized that was not really what I wanted to be. And so after about 12 years, I stopped and decided to come and do PT. So really I had nothing with PT in the Army. So total change.
What year did you enlist?
That was in 2007.
In 2007, and you went to what, OCS then? You were an officer,
so I was
you
a
said?
combat engineer, technically in 2007. Yep.
And were you ever stationed here at Fort Huachuca?
No, actually, I had friends here. They always said it was great, but yeah, we did some time in Benning and some at Lewis and some at Drum and a couple other training locations, but yeah.
And what was your first impression of our community here at Fort Huachuca when you got here?
Different. I thought Huachuca City was the town at first. I wasn't quite sure where I was going, and then I kind of crested the hill and it kept going, and I thought, all right, this is
getting better.
Here's the fort. Like I thought I missed it for a second, and it definitely enlightened me because it looks like it's in Mexico, and especially from New York where I was.
Oh, is that where you're from originally, or?
Yeah.
Is from the East Coast?
Mm-hmm.
So being out here where everything is kind of like brown and not much water and dead and everything, it was different. A big adjustment for you then, would you say?
I would like to point out, he won't tell you, but he did get the George C. Marshall Leadership Award while he was in the military.
Oh, wow.
I'm a big George Marshall fan, and I like that he's a leader in our company, so both of those mean a lot to me.
Are you military as well?
I'm not.
No, but you knew enough about his career, though. That's pretty impressive. So I was going to ask, what brought both of you then to Sierra Vista to set up your practice? But I guess we kind of answered that earlier because you said that you had started the practice. Where did you said you came from Idaho?
No, we moved. I've lived a lot of places. We moved from Baltimore, Maryland.
Okay.
And I was at the hospital for about a year, and ended up wanting to stay in town, but do something different.
Okay.
And so I teamed up with Travis Furry, he's a chiropractor, and his office, and so they do our billing and scheduling, and I was able to start small, and it was really a great blessing to us to be able to start without a lot of expenses early on, which helped,
Right.
which helped tremendously.
How did you find out about Sierra Vista, though?
So an old classmate of mine is from Arizona, so we were classmates in Utah, and he moved back near home. He's from the southeastern Arizona, and I ended up in Maryland, and he posted on Facebook that he was here at the hospital and people should come join. I said, I'm not too interested, but talk to me, and I thought it'd be a temporary stopping point until we went on to the next thing, and now it'd be pretty hard to leave. So,
Well, I'm glad to have both of you down here because it sounds like you are providing a very valuable service to our community. It seems that a lot of today's pain management in our society revolves around prescription medication. What are your thoughts about that?
So I have a lot of thoughts. I really like to look at medications like you sprain your ankle and you might wear a brace.
Mm-hmm.
You wouldn't laugh if I said, wear the brace for about a month. It should be really effective. You'd probably say, okay, yeah, sure. But if I said, wear this forever, you might laugh. And sometimes I think we get caught behind that with medications. They're great short term, and even some are great long term. But for the most part, that short term fix should help us do something else. I think that's what we're missing, unfortunately, in the medicine world. And we can capitalize on that because while you're taking a medication for pain, you can come to us. Hopefully we can introduce a bunch of other techniques that make you make your own medications. And that's primarily what we do in our clinic is if we create a drug and a pharmacist creates a drug, it's only created because we have the capacity to make that ourselves. We just might not know how to. And I think that's where we come into play is help create that naturally.
Well, when it comes to medication too, you also have the addictiveness. And I can relate to that because being on those pain meds and the VA wanted to cut you, our first thing is, well, we panic because that's our lifeline. We're used to that. And knowing that there is a chance to get off of those because not only are they addictive, but they're also like mood altering, and I mean it can really affect who you are on medication versus off of it. So what you guys are saying is really appealing to me. So I'm really interested in what you're saying here. Thank you for that. So Sierra Vista is number 3 in the country measuring veterans per capita. And I imagine that you must see a lot of veteran clients yourself.
Yep.
Tell us about that.
I'd never been around much military. Obviously I've had grandparents that served and, talked to them. But as far as, people in my everyday life, this heavy, I'd never been, it's number 3 in the U.S., you said?
Right.
I haven't been in 1 and 2. So this is definitely the most that I've ever been around. And I've learned a lot and I've quite enjoyed that. So.
How about yourself, Dr. Davis?
Yeah, I mean, I definitely, if I were to pick who I was treating, of course I'm going to always enjoy someone that I see with the VA network, whether because I connect with them or just some of the people in the network aren't getting maybe the care that I want them to get. And so I have a heart for that, that group of people.
Right.
So I'm going to lean towards them, obviously. So pretty fun to have that as part of our insurance base, if you will.
Do you have any issues or concerns with how you guys have to go through the VA to get some of the veterans treated? Or do they come to you pretty much with their own good to go and you don't have to go back through the VA to get... A lot of times what we have to do is we have to go to them and we have to get like referrals, go through like community care or stuff like that. So I'm wondering how that aspect of it is. I know that you're the doctor, so that's more the staff probably type of question, but I was just wondering about the relationship with the VA.
I know you're closer to that.
Yeah, so many states, the push is to have physical therapists be front line so they would come to us first. Arizona is one of those states. but some insurance bases still have a way of tracking their clients and their patients, and that way is basically go to the primary care, then the primary care gets the referral and sends you out to PT. Unfortunately, the VA is still there. I do think that might change in the near future, and along with it probably TRICARE and some others. So I think we're close, just not quite. That's an aggravating thing to answer your question.
And the veterans definitely are dealing with that frustration every time that they need something, like going through the VA to get what it is that when we served our country, just the medical care alone. And it's like, I don't know, maybe trying to pull teeth without Novocaine or something, trying to get them to do things to help us sometimes. It's, do you see, let's see, I asked you that question. A lot of the veterans that we work with here at the Warrior Healing Center have shared that they are prescribed a medication that they do not want to be taking because of like side effects, things of that nature. Do you hear that a lot from your clients as well?
Yeah, it's always funny hearing those types of, funny may not be the best word, right? But we definitely hear that a lot. And I think about why did they get that? If they don't want to be on it, why did they get it? I think a lot of it's, you go to somebody for help, you go to a medical doctor, and what are they going to provide? They're a doctor of medicine. So normally you get medicine. They don't want to say, the provider, the medical doctor doesn't want to say, I can't help you or don't do anything. So a lot of times what we see, not just in VA, but everywhere, here's a medication, and then go do this 1 or 2 or 3 other things. Like, basically, I want you to get help, go try all this stuff. And then we have people saying, well, I don't want to do this or that. And I'm thinking, that doctor was just trying to help.
Right.
But they didn't have the time to elicit, what are your values? What do you think would be helpful? Why don't we try this? And then too often, it just, well, this is what the doctor gave me, this is what I'm going to start trying. And it starts on that path. And sometimes it can be very helpful. But a lot of times, most people don't want to be on opioids.
Right.
And the vast majority of people don't want that. But if they start getting off, sometimes there's withdrawals and the pain gets worse. So it makes it very difficult. Sometimes there's a opioid-induced hyperalgesia. So the longer you're on it, then the pain can actually get worse. But then when you try to get off, there's withdrawals and it gets even worse. And it's a tough cycle. Right. So our goal is always to discuss where they're at. How can we take them to where they want to be?
See, I was taking OxyContin. I think it was like 40 milligrams, like 3 or 4 times a day. And that was not the OxyContin. So, and then when I had my hip replacement surgery, I didn't need those medications. So I was taken off of them, and I was glad that I got off of them, and I felt so much better. But what hurt me was not having the physical therapy, the hands-on tools that after I was taken off that medication, I had no ways of coping with because it was a different type of pain. Because when you have hip replacements, you've got these muscles that were, I haven't used in years. They haven't been stretched out. Now you're trying to use these muscles, and so you're getting this different type of pain. It's not a joint pain. It's more the muscular pain.
Yeah, and that's where we can really help people. Is they're getting off them, they want to be off them, but they're having different pains. That's where we can really, really help people. We have a lot of techniques for that.
Oh, wow, that's awesome. What do you think is the toughest challenge that your clients seem to face?
That's a good question.
I would say, if I were to canvass everyone, the majority of people would say I'm not being heard when I'm talking to certain providers, not just in the VA, but just in general. And maybe that's because they only have 8 minutes with a provider, or maybe the patient themselves are trying to push too much and just quickly spill it all out. Either way, I think that's the biggest one, is they're not heard when they go in, and then something's missed.
And just to be clear, I'm not bad-mouthing the VA at all, because I've gotten a lot of great care over the 40 years that I've been going there. But it's like what you just said. Sometimes you don't feel like you're being heard, or they're constantly changing the way that things are done without informing you that that they
Yeah,
changed
sure.
the way that things are done. So I'm very grateful for the care that I've gotten at the VA. So I didn't want to make it sound like I was anti-VA, because I'm definitely not.
I'd like to piggyback off that a little bit then.
Okay.
One of the challenges in healthcare is the silos. And, this is what I do. If I can't do it, then I'm going to send you here. And sometimes people get bounced around to different people and they're like, well, I can't help you. And they do all these different providers, and we call it being medicalized. That's something that may have been pretty simple. That you get past, you get some imaging, you go to the next one, and all of a sudden, what very well could have been a small problem, it can be made even bigger. And then
Right.
when we do have big problems, sometimes you have to go 10 different appointments to get 10 different providers. We try to play a little bit of the primary care role of, okay, who have you seen? What's missing? Hey, this is what's helpful, but then go here, let me know how it goes. We can help manage that care a little bit.
Wow, that's great. What is it that you guys are, Rainey Pain and Performance, are most successful at treating? I hope I didn't just ask that question, because when I ask a question, I'm trying to check it off on my list.
No, that's good.
So, okay.
I would probably say arthritis.
Arthritis type?
Osteoarthritis, particularly. That's what, maybe because most people come in thinking there's nothing that we can do for it, because they look at it as a wear and tear. This has been there for a while, and it's because of activity that I've done in the past. And so either if I keep being active, which where most people want to be, and then it's only going to get worse, or else I have to go on bed rest and I can't do anything, and they don't want that aspect, so they feel like they're on this downward cycle. And we have remarkable results. Some people get totally pain relief. Most of the time it's 50 to 75%. And then it's teaching them how to manage, how to anticipate when it's going to come on, how can they be active, how can they live their life with minimal pain, not just grinning and bearing it. And so it's quite rewarding to help people who think that there's no way they can be helped without surgery.
Right.
And so that's one of the most successful things we do.
And to add to that, maybe quality of life. I think if I love to go bowling. I love to bowl, right?
Yeah.
And then all of a sudden I can't bowl because of a hip or a knee or whatever the case may be, and then I can't bowl. Well, then my quality of life to me has gone down. I used to, because I always loved playing sports. So again, these are quality of life issues as well, wouldn't you think?
Yeah. I mean, I think about bowling. If it's bowling's been pretty good, it's not very good. I took a week off, I tried to get back, it still hurt.
Yeah.
That's the perfect time to see us.
Right.
If it's been 10 years since you bowled and now all you do is sit on a couch, it's going to be a lot longer to get back to bowling. As you can imagine, it's the earlier we get it, the better.
No overnight successes. You have to work hard at it. What is it that you enjoy most about your work?
I like to see the light bulb switch. It's probably my favorite part. And it could be pain related, it could just be weakness related, it could be a lot of things. But when that aha moment kind of clicks and they've recognized that this could work, it's pretty exciting. It gives me a big smile. And I like just to walk them up and see them smile too. It's pretty cool.
And I would say when people have been to a lot of different places, for instance, I saw somebody the other day, and I've seen this before. I'm like, I bet I can help them quite a bit. Let's go and make sure it is what it looks like on the intake paperwork. Sure enough, I said, I think you're 90% better in 4 to 8 weeks. And you've probably seen a lot of other people, a lot of other different ideas. And he's like, oh yeah. And I think, if he would have ended up in our clinic a little bit earlier, how much more could I have helped him? But that's, it's my specialty. It can be helped conservative. They haven't seen things on imaging. At first they did, but then and now they're still having pain. I think this is the type of person I can help a lot, where they've tried lots of things. They're very motivated. This isn't a pain seeker. This isn't, somebody that doesn't want to get better. They want to get better. They've seen a bunch of people. And then that moment where they're like, hey, this is working. Why it seems simple. It's simple if you know what to do for it.
Right. Good answer. Like that. What types of therapies do you offer?
A lot. Primarily manipulative therapy and structured exercise.
Okay.
I'll never forget somebody sat down and I was, I don't know why I'm here. I already exercise. I think I'm not just a cheerleader, to tell you to
Okay.
get to go exercise. Exercise, like we talked about earlier, is important. Bodies that are healthier, exercise. And typically the healthier are, the happier we are, right?
Yeah.
But a lot of manipulative therapy, sometimes we can, it's high velocity, low amplitude thrust manipulation. So we manipulate the neck, low back, hips, knees. Sometimes it's lower velocity. Sometimes people don't like the quick or the pop. They need it more gentle, or maybe that's just what they need. We also do a lot of soft tissue techniques. We do dry needling, myofascial release techniques.
What's the dry needling? What is that? Like, are you talking about like acupuncture?
Like,
Or
so they're the same needles, but
Uh-huh.
it's a different use. So what I like to say, it's the same needle, but we don't talk about it in terms of qi or any oriental medicine.
Right.
So if I'm an acupuncturist, I have to go to school that I learn oriental medicine. All mine is Western
I
doctrinal
didn't
training.
know that. Interesting.
So, yeah, with the Western doctoral training, I'm going to talk about I'm targeting this muscle, I'm targeting this nerve, I'm targeting this tendon, I'm targeting this ligament. These are the physiologic processes. These are the hormones I want to come in there. This is what I'm
Wow,
targeting. But it's
okay.
just harnessing your ability to heal. We're not putting anything in there
Right.
that we're stimulating your body.
Wow, I like that.
Did I miss anything that we provided?
What is your advice to people who suffer in pain? Just accept it as part of the cost of life and having served in the military?
It's interesting. So I would say, yeah, accept it if you don't have any hope, and that is, I think, what we really need to focus on. If I truly believe, if I'm in pain, I truly believe I've got no hope, then I should just accept it. But I'm really hopeful that we basically just shed hope, and it's not just saying it at the end of the eval. Hopefully people actually believe, like, wow, I already feel somewhat better, and there's way more to come. So that acceptance should be kicked out the window at that point.
Okay. How do stress and anxiety interact with physical pain symptoms?
I tell people, normally stress and anxiety don't cause all your pain, but no one's ever told me they've been stressed and all their pain went away. There's a close interaction. We can't separate the mind, the body, our emotions. That pain and emotions, they're processed in the same area of the brain. And so it's not just stress causes pain, but it amplifies things that are already there. So if I'm more stressed and I have arthritic knees, it's going to be easier to feel a pain in my knees because of the stress. But the stress doesn't cause the arthritic symptoms.
And how do you treat patients who have pain that stems from the emotional crisis?
So it's kind of tricky. And that's where listening in the very beginning matters quite a bit. So we can try to figure out what's the coping mechanism or what are the triggering events. If we just listen, generally we figure that out based on what that patient tells us. And then if we identify those, it's a little easier to address the pain. But without that, if we only give the person 8 minutes and try to tell them how to fix their pain, it's likely not going to work.
One thing that I'm personally, again, impressed by you gentlemen is you keep bringing up this ability to listen to the patient. And so many times when we go see a doctor, we feel like a number, like we're just, hurry up, next check.
Sure.
So the fact that you're both bringing up this ability to listen is very impressive.
I learned early on that listen to the patient, they'll tell you how to help them. Typically they've done something or they've identified something that kind of helped. And then I always say, your body, I know the human body. You tell me what your experience has been and I'll be able to find something. Okay, let's do a lot more of that. Let's juice it up with this. And then you'll really be able to see the relief that you're looking for.
What do you think that patients tend to find scariest about treatments? And what are the hurdles many of them have to get past to get on the path of healing?
I'll let you do the scare thing. I think the big hurdle is they've had physical therapy in the past, and physical therapy could be a bunch of things, and likely they had a bad experience, and so they come in already with a preconceived notion that, like, why am I here, or how is this going to help, how is it different than last time? So already trying to jump that hurdle is primary goal the first day. As far as scary though, I don't know.
Yeah, I think but back to the opioid discussion, some people are scared that we're just going to tell them to get off opioids and that their pain is going to get a lot worse. So I say, here, I'm on your team. Where do you want to be? What do you think the best way is there? These are things I've seen be helpful, that we're not there to, it's not authoritative care. It's shared decision making.
So, Warrior Healing Center chimed in here. Listen to the patient. They'll tell you how to help them. Very good.
I say that to people all the time.
So on your website, it shows that a huge list of your pain conditions that you're able to treat. What would you say are the most and least common injuries and complaints that you see?
The most, aside from arthritis, that's definitely the big one. I see a lot of just weakness. Like I was in the hospital for a while, and I just feel really weak. I just need to get back, like you said, the quality of life aspect, or I just haven't been doing much because of COVID, and I just feel like I can't even get out of a chair. So I see that quite a bit, aside from arthritis.
I know we all do a lot of low back pain and low back related pain. So whether it's sciatica, some form of sciatica can be a number of different things. But if all we ever saw was low back and low back related things, we'd probably still have over half of our providers. I mean, we see a lot of that. As far as the least, I don't know. I always think that there's more people that we can help than actually come in. I think the data is somewhere between like 10 to 20% of people with low back pain see a physical therapist. If that could be 70 or 80%, a lot of people would be doing a lot better, and it wouldn't be so debilitating to their life.
Tell us about functional pain management.
So that's something that Nick and I have been working on for several years now, and it continues to be molded into different things. But currently, it's just a way for us to assess all of the ancillary things that could cause the pain, rather than just saying you're in pain because of this structural damage. And if we can get at the root of all of those things with actual measures, then it's not just us assuming that you can't cope with something or assuming anything. And so there's about 10 different objective tests we can ask, or questionnaires we have them fill out. And that very much so can drive our plan of care, rather than us just assuming that the person needs meds or assuming that the patient can't handle the pain.
Yeah, it was when we first started it was to combat the perception that I've been to a physical therapist, I got on a bike for 20 minutes, they put me through exercises and it hurt so much so I left. Like, hey, we're focused on the pain. We're not just focused on you getting stronger and more range of motion.
Okay.
Everybody wants to be stronger and have more range of motion, but
Yes.
we are going to focus on your pain, and we're going to help your pain, and if that's what you're here for, that's what we're going to focus on.
Again, having ankylosing spondylitis, range of motion is a big one, let me tell you.
Yes.
Especially with the neck and, yeah. So Donna Grable here added that they are great. They helped me tremendously after an accident that I had. She's a volunteer here at the Warrior Healing Center.
Oh, cool.
Thank you, Donna.
Yeah.
Tell us about the classes that you offer to your patients.
Yeah, so that's primarily, they see us for rehab care, we'll call it. That's where we're starting out, and then when they progress past that, we'll ask them if they want to do some sort of class. So that's helpful because we see a lot of community aspects that can drive anxiety, depression, pain down significantly when they're just simply in a community group. So that's really the thing that we develop, is the community. We do it through exercise, and that's just one way to do it. And that's another avenue, so they can ask questions that allows us to research and give them basically evidence-based advice, rather than from a social media influencer or
Right.
from Johnny, whoever. So that's kind of the whole aspect there.
Do you have anything to add to that, or?
I've never seen classes be this successful anywhere. We have a lot of classes. Dr.
And-
Davis has been the driver
And good
of that.
attendance and
Yes.
great.
I have, a lot of places try to do classes. I've tried to do classes elsewhere, and they've never. But what we've been able to build here, I say Dr. Davis has been the driver of it all. It's been remarkable. We talk about loneliness as an epidemic now in the United States, and people not exercising enough, and we get to solve both those problems. In exercise class, people become friends. They get, personalized care. So, sometimes they get to do what other people are doing. Sometimes they need to be held back. They need to step back, and we need to do something more specifically for them. And then they get to, be assimilated back into, the group classes. But they've been just phenomenal. People, that's one of the best things that we have.
Yeah, and we're not alone. If anyone ever wanted to do this in another state, they're called medically oriented gyms, or MOGs. Other states also have them, so they definitely exist out there.
Dr. Davis, you brought up COVID earlier, and I never really had thought about it, and so I'm kind of going off of what Dr. Rainey said about the loneliness, because when COVID did happen, what did we do? We were all social distancing,
Right.
shut down. So, I mean, COVID happened. It affected our whole country, our whole world. Are you still seeing the effects from COVID on people's bodies when they're coming in, like with muscle or pain issues or any of that kind of stuff that you know of?
Not as much as I think we should. Some research I've done recently, they talk about long COVID, and the symptoms are similar to other nociplastic conditions, which is a scientific word, but it's basically the pain isn't made up, but I can't see it. And there's a little bit more to it than that. But long COVID, a lot of the symptoms are there, and they're similar to like a fibromyalgia symptom, where
Right.
it's just everywhere. You can't go look at it on an x-ray, but it's very real. And we could help a lot more people in those situations than I think end up in our offices.
And the data still isn't out on that. I mean, we're just beginning, really, right?
Yeah, there's a decent amount of research, but there could be a lot more. You probably know a lot of the research better than I do.
Yeah, I mean, a lot of it has been biased, and I think it's a bit more unbiased now. I think the whole idea with long COVID is that it exposed a potential fault, and now we're just starting to see that potential fault. And what I mean by that is, maybe there's a small, crack or fracture somewhere, and I mean that just throughout the body, not just a bone.
Right.
And maybe COVID just happened to expose that, and now the person's having like shingle pain or whatnot, but they can't really feel it. And 5 years from now, maybe we would see it. But due to COVID, maybe we're seeing that earlier, and that's why it seems a bit elusive. But yeah, we are seeing quite a bit.
I hadn't thought about, when I was talking about questioning you guys, I hadn't really thought about COVID until you had brought that up. So it's not like I live, eat, and drink all the articles and the stuff on COVID, but I'm glad that you just brought that up, because not only is COVID affect the respiratory, but it also affects the central nervous system, which also affects our muscles, and I mean, it's the whole body.
Yeah.
So that's why I wanted to ask that one question.
And one thing that people are surprised about is they'll get aches and pains sometimes with sickness. And it's easy with the fever, it's up, then it's down. Sometimes it lasts a little bit. It's a neuroimmune response. And so our immune system affects our nervous system. And that can play out in areas there it was already a little bit inflamed, or, is borderline, and then that exposes it.
Right. It's just like I said with the social distancing, and then and now we're just now getting back to some type of regular, getting back to life again. So I'm really glad. So thank you for giving us that information on that. Please let us know, where are you located, and how do people find out more information about Rainey Pain and Performance?
We've put a lot of time into our website, so it's always a good idea to go there if you want to look at conditions that we treat, types of interventions that we do. We have, I like to say, 1.5 locations.
Okay.
At 125 South 2nd Street is where most of our providers are at. Across the street's kind of catty corners, 200 East Wilcox. That's where we answer our phones and everything, and that's where we have 3-4 providers at. Dr. Davis is across the street, so there's some days I don't even get to see him. But it's 1.5 locations. We don't run them as separate offices. Like, it's all
Right.
one phone, it's all one fax, it's all
Right.
one website. But depending on Who you're seeing depends on which one you go. And if you go to the wrong one, we walk out the door and we point across the screen and say, head over there.
What is the website?
RaineyPainandPerformance.com.
Rainey,
Pain and Performance.
RAINEY,
Mm-hmm.
Pain and Performance.
Yep.
.com.
Yep.
And that's and spelled out, right?
That's
Because I'm asking because we'll put it in the
Oh, that'd
title
be
of
great.
the interview, so that way people can click on it and then they'll be able to go right to your website. So,
Yeah, that'd be great.
do you have any last? Oh wait, we got something else here. Got another question. Great. What are the biggest concerns that you hear from your veteran clients, and what is the best advice that you can give them?
I'd say as far as physical concerns is typically they're concerned that their body that there's wear and tear in their body and that it's just going to keep getting worse. And
Okay.
the best thing that we can do for them is help them see it doesn't have to keep going downhill. That with the right interventions and the right coaching, the right formulating of activity, we can help them start doing better even with the wear and tear that they see on imaging in their body.
What about the mental aspect? And the reason why I ask that is here at Warrior Healing Center, one of their biggest drive is to end veteran suicide, which it's 22 or more veterans a day end their lives. And so when you're ill, whether it's your body or your mind or both, and they are wanting, to get that help, what can we do?
I know we've talked about that a decent amount. If you want to chime in on that.
Yeah, I just think one of the best ways that we can combat any sort of suicidal thought is by achieving the patient's actual goals. So say the goal is decrease my pain. If we actually focus on that, then hopefully some of the mental health aspects can be achieved. But what if the goal isn't the pain? What if the goal is quality of life, like you had said? Then really just focusing on that, not all the ancillary things, but saying, okay, well, that's our focus. That will improve mental health. And there's a lot of research backing that actually as well.
Oh, wow, great.
Yeah, what we know is that if we just work on depression and not on pain, that it's easy to have depression come back. If we just work on pain and not depression, it's easy for the pain to come back. We've got to hit.
You got to hit
We've
both
got to hit
ends.
both of them. We also know that just exercise, regardless of the symptoms, is very helpful for depression. And so if we can hit all three of those, that's really where the magic is.
Great. Is there anything else that you'd like to share with our viewers?
Nothing in particular.
Any kind words of like inspiration or, any last words that you'd like to leave?
There's always hope. That's definitely, if I could create a motto with us, is like at least try to find something. And I would hope that everyone that leaves the doors has some resemblance of hope, if not a lot.
And I'll feel forever blessed that I've been able to be here in Sierra Vista and be able to work with so many veterans. Whether it be working with or treating, working with the organizations that serve veterans, whether the Warrior Healing Center, the VA, up on post, that my life is definitely better for it. So I thank you all.
And then Mayor McCaw just chimed in here at the end and said, love the conversation. Great show. Thank you, Mr. Mayor.
Thank you, Mayor.
So again, Dr. Rainey, I thank you so much for coming down and sharing. Dr. Davis,
Definitely.
thank you both for sitting down with me and letting us know about what you have to offer to our veteran community. And not only our veteran community, but also our non-veteran community, because obviously you serve both. So,
Thanks for taking the time out of your evening to be here, Mike. And,
my pleasure.
and serving in this
I enjoy
wonderful
this.
center.
Cool.
A lot of the questions that I had were given because I'm just not that good at some of those questions. I have to give credit where credit's due. That was Kathy's a lot, because she was a nurse and she's just.
Kathy's impressive.
Yeah, she knows she knows her business for sure. So thank you, Kathy, for helping me with that. So, okay, so that's it for this show. Again, I won't be here on Friday, be at a convention, but I'll be here the following week after that. So everybody have a good night. Thanks for joining us. Once again from Rainey's Pain and Performance, Michael Zehr. Take care, everybody. Have a good night.